Okay, for knee IFC, these are the stuff that we usually get. We have an ice bag, a gel pack, ace wrap, and if it's too cold for the patient, pillowcase. Here's the pad placement for knee IFC. You want the pads around the joint capsule, and you want to stick with the same concept, how the reds are diagonal from each other, blacks are diagonal each other, making like an X. So if you want to, all right, so knee IFC, you can either place the towel over like this, and then put the ice bag over the kneecap, over the joint capsule, making sure you get the bottom part of the patella tendon. And this is a really bad ice bag, so. Gel pack goes over the quad. You can have the patients help you, because sometimes it's a little hard to wrap around with the ace wrap, but here it's pretty stable. So. And what I do, I just wrap around the leg. Tell the patients they could slightly flex their knee.
And then sometimes patients need two, so 2 A traps. So you can go ahead and do that. It really depends on the patient. You just want to basically get the knee.
This generally ends up looking like the finished product. Gel pack over the quad. The ice bag is over the knee, making sure you reach the bottom part of the patellar tendon. Now we're going to show you setup. All right, setup. You always want to use the bolster to have a neutral spine for the patient. So you ask the patient, okay, so Francis can do it himself, but usually you ask the patient to tighten their ab muscles, and then you can help them up. You can help them up using your hands like this, and then scoop the bolster in. But generally the cues are tighten your ab muscles, bring your knees to your chest, stuff like that. And here's Francisco, post knee IFC. Remembering the bolster, and that's it.
So a slightly different way of doing the same thing would be to have a patient lie back, and then normally they can lift their feet up, but you can also help them. Put it like halfway so that you have room to work with. Scoot this out a little bit. We'll pretend the stim pads are on there. You need the pillowcase. Ice bag covering the whole knee. The quad, have them hold it. I usually just ask them if they can just hold that for a second. And it's easier to wrap from the other side, but it's basically the same thing.
Start the bottom.
And they're good. So, same thing, just slightly different way of doing it.